Pancreatic cancer is the 10th most commonly diagnosed cancer and the 4th leading cause of cancer death in the U.S. We spoke with Dr. Kevin Rice of Valley Presbyterian Hospital in the San Fernando Valley. He talked about this form of cancer and how it's currently treated.
Pancreatic cancer is a tumor or an abnormal growth in the pancreas. Usually it's what's called adenocarcinoma, which is a type of cancer that grows from the ducts of the pancreas. And typically it's not a good cancer to have, if there is such a thing, but typically it's sort of got not such a great prognosis. Typically with pancreas cancer, symptoms come later when the cancer gets to be a little bit more advanced. So it can be jaundice, when the bile ducts become blocked. You can get jaundice where your skin turns yellow or your eyes may turn yellow, usually the white parts of the eyes. That you can see that easier in the patient than on the skin. And sometimes you can see weight loss or nausea, vomiting, general malaise, or even depression. Well, I had the opportunity to meet Nicholas, and he came to the hospital, I think to the emergency department, with jaundice, actually, and didn't know why. Wasn't having any pain. And we did a CT scan, and it showed a mass in his pancreas. And in addition to that, his bile ducts were distended or dilated. The bile ducts are in the liver. Well, his bile ducts were dilated because the pancreas cancer, or the tumor in his pancreas, was blocking the bile ducts. So that's how we made the diagnosis, was from the CT scan.
Dr. Rice explains the surgery performed.
What we did was, it's sort of a newer technique, is went through his skin on the side, into the liver, and through one of the dilated bile ducts. We put a needle into one of the bile ducts through his skin, and then through that bile duct fed a stent. So this is the stent that we put in Nicholas. It's pretty small, but when we put it in, it's even smaller. So this is how it goes through the skin and through those small bile ducts into the patient. And then gradually inside we open it up, and it restores the natural flow of bile in the patient.
According to Dr. Rice, the patient is doing well.
Nicholas actually is doing remarkably well right now. His jaundice is gone. He's actually gained, I think, close to 30 or 35 pounds. He looks great. He's having some great time with his wife and his children and his family. So I think he has, right now, a bright future. He's beating the odds.
After the procedure was done, I started getting energy back. And I actually felt like $1 million. I would tell my doctor, I feel like I could run around the block, but you're telling me that I'm sick. But the procedure that was done with this stent and with this technology and with the knowledge that he had to do this, and did not give up, which I can never forget of what he did. Gave me a second chance in giving me the strength to fight my cancer.